As she does that, I'm going to watch how she does it. Does she have to poke her chin forward, or can she remain neutral? So 2 and a bit, which would be within normal limits. Then I'm going to control her head movements while I do active range with overpressure resistance into each of those 6 movements that we've just mentioned. Open for me. So remember, this is the most vulnerable position, so don't reef on it. You're going to just use the web space on the jaw, push down and hold. Don't let me push any further. Okay. In terms of ligaments, I'm testing the lateral collateral ligament. In terms of muscles, I'm testing the muscles of closure, which would primarily be the temporalis, masseter, and medial pterygoid. Then I'm going to take the jaw and just attempt to tap it. It's one of those things where if you have badly fitting dentures, or the person cannot close their mouth, which is going to happen with an anterior dislocation, you can actually tap the incisors together by doing that little, and then don't let me lift anymore. Muscles of opening being tested, which are lateral pterygoid and digastric. Poke your chin towards me, over pressure and hold. So I'm testing the muscles that pull the jaw backwards. What's that going to be? This is going to be digastric. Predominantly, but some of the external tongue musculature as well. Predominantly the geniohyoid. Geniohyoid is the muscle that attaches to the genial tubercle. It's called the mutual symphysis. Behind there's another tubercle called the genial tubercle, meaning where it comes together. And it goes from there to the hyoid. So obviously it can pull the jaw backwards. Now pull it back, close, and hold. And then I'm testing the muscles of protraction or protrusion, which basically tests the muscles of closure. Towards me. When I do this lateral deviation, primarily what I'm looking at is opening this side on the left, closing on the right. So again, this side will stress the lateral ligament, this side will stress the intrinsic ligaments. And when I resist, which muscles am I testing? If we look at the skeleton, we'll notice that the angle of the mandible is more central than the zygomatic arch. So if we're bringing this more laterally, then the muscle on this side that's working is going to be the masseter on the same side. On the opposite, pulling the angle towards the central part of the head, i.e. towards the lateral pterygoid plate, will be the medial pterygoid. So when we chew from side to side, predominantly the movement anyway is being created by the ipsilateral masseter and the contralateral medial pterygoid. The power of biting, of course, is then produced by temporalis. You need to control the head as you're doing all these movements, because you start moving the jaw, the head will follow it. That's one of the defense moves, right? Pushing somebody through the jaw, taking their head back. So she's going to tend to move in any direction you push her, so you have to stabilize the head. Having done that, I now stand behind her. I say, okay, open for me. Close. Open. Open again. Is that as wide as you can go? Oh, okay. I'm thinking, I'm sure she moved more than that. Okay.
Sorry.
So what we notice with Hallie is that she goes evenly to begin with, and then right at the end she jumps forwards with an opening click. So she is officially hypermobile. Conscientiously hiding the fact that she did have a forward head posture.
I've been working on it.
And there's all these things that you can actually pick up as clues, because one of the things, of course, with a forward head posture is it also affects breathing very adversely, so we'll talk about that later. Now there's the scan. What I'm looking for is clicks. If it's an opening click at the end of range, this would be a typical forward head posture opening click. Nothing of real significance as far as the jaw is concerned. If the click occurs at the beginning of the movement, then it's quite likely that the head of the mandible is posteriorly dislocated and relocates on opening. If the click is occurring somewhere in the middle of the joint, but it occurs consistently, especially if it's an opening and closing click, then we would have to be suspicious of an intradiscal tear. And if we come to that conclusion, then the patient does not need to be seeing us. They need to be seen by an oromandibular or dental surgeon who can do a properly fitted mouth guard or brace. Okay, so let's just do the scan quickly and then we'll break.